Member for Melton.
Thank you, Acting Speaker, and I rise today to contribute to the Children and Health Legislation Amendment Statement of Recognition and Other Matters Bill 2022. And I do so, of course, on the traditional lands of the Wurundjeri people as traditional owners of the land that Parliament is built on. And I would like to acknowledge them and their ancestors, past, present and emerging, as I didn't get an opportunity yesterday to contribute to the treaty legislation, which was unfortunate, but I do want to acknowledge the First Peoples Assembly from yesterday. And I also wish to acknowledge the great contributions by many of the members, but in particular, and the member for St Albans alluded to it, the contribution by the member from Geelong. It was an amazing contribution. I know she's in the House at the moment, and I thank her for that wonderful contribution. This bill today seeks to amend the Children, Youth and Families Act 2005 to further embed the Victorian Government's commitment to Aboriginal self-determination in the legislative framework for children and family services. And it does it through introducing an Aboriginal statement of recognition and accompanying binding recognition principles. It enables the effective functioning of Aboriginal children in Aboriginal care, and it enables the Children's Court rules to delegate powers to a judicial registrar. This bill also seeks to amend the Health Services Act 1988 and the Public Health and Wellbeing Act 2008 to introduce a statement of recognition and non-binding principles to further Aboriginal self-determination in the health system. I'm also pleased that the opposition, those opposite, support this bill, and I'm really pleased on that we are collective on such an important bill. Further changes will be made to the Child Wellbeing and Safety Act 2005 to address critical regulatory gaps in the reportable conduct scheme, the Social Services Regulation Act 2021 to provide for necessary transitional provisions required to support the commencement of the new social services regulator, and the Worker and Carer Exclusion Scheme, but also the Commission for Children and Young People Act 2012 to ensure the Commission for Children and Young People can advocate on behalf of children and young people in the child protection and care systems. This is the right time to introduce these amendments, with yesterday the introduction of that fantastic bill, the Treaty Bill. We have a lot to learn and still even further journeys to go around the work needed for reconciliation and for treaty. A key feature in this legislation, along with treaty, is the need for recognition of self-determination. As a Western society, we have done poorly on addressing this. Even this year, I've had discussions with councils who want to advance Aboriginal services that haven't even spoken to the local Aboriginal groups about their plans. So we must change our outlooks where we try to solve problems like closing the gap and not asking those most affected by this disparity about what they actually want. Self-determination needs to be the first thought when all levels of government seek to make policy or address concerns for Aboriginal communities. And I'm proud to be part of a government that has started the process and introduced legislation like we saw yesterday and this legislation today, albeit that it should have been done probably a long time ago. We need to walk towards reconciliation, and legislation like we've seen in this Parliament this week is the start of that journey. So the evidence is clear that the single biggest factor in improving health and social outcomes for Aboriginal people is achieved through Aboriginal self-determination. This bill provides significant reform opportunities to achieve self-determination and self-management for Aboriginal people, and to strengthen provisions that uphold the importance of culture for the safety of Aboriginal children. We recognise that Aboriginal people are best placed to lead and inform responses for Aboriginal children and families. And we also recognise that Aboriginal people have the strengths and the right to lead that change for their own children. This bill reinforces the Victorian Government's commitment to Aboriginal self-determination in health and child protection systems. It also acknowledges the importance of culturally safe and appropriately resourced services to meet the health and wellbeing needs of Aboriginal people right across Victoria. It also progresses the key commitments and priority strategic directions under the Wangarel, can't pronounce it, but Gapyajur Aboriginal Children and Families Agreement 2018. And at the heart of that agreement is a commitment to reduction of the overrepresentation of Aboriginal children in child protection and other alternative care. And we are going to achieve that by enabling the advancement of Aboriginal models of care and transferring decision-making for Aboriginal children to Aboriginal community-controlled organisations. And this bill is an important part of achieving that vision. It is an important step in our plan to meet the Closing the Gap National Agreement target to reduce the rate of overrepresentation of Aboriginal children in care by 45% by 2031. In particular, this bill advances the objectives of eliminating the overrepresentation of Aboriginal children and young people in care by increasing Aboriginal care, guardianship and management of Aboriginal children and young people in care, and also by increasing family reunification for Aboriginal children and young people in care. So in the health sector, the bill progresses a major priority of the Aboriginal Health and Wellbeing Partnership Forum by enshrining commitments to Aboriginal self-determination in our health legislation. This also progresses the government's commitment to Aboriginal self-determination as set out in the Victorian Government Self-Determination Reform Framework. So through this bill, this Parliament will specifically acknowledge Victoria's treaty process and our shared aspiration to achieve increased autonomy and Aboriginal decision-making. And this includes greater control of planning, funding and administration of services, including through self-determined Aboriginal representative bodies established through treaty. And through this, the government will make clear our commitment to treaty and the reform work currently underway. So this bill aims to reduce Aboriginal overrepresentation in the child protection system, supporting the commitments of the Wangaratta Agreement, the National Agreement on Closing the Gap, and Victorian Aboriginal Affairs Framework. It supports the Victorian Aboriginal Affairs Framework through government working in partnership. And we all know that if you work in partnership, you get much better outcomes. So we want to work in partnership with the Aboriginal people to meet the goal that Aboriginal children are raised by their own Aboriginal families. In recognition of the historical importance of the Statement of Recognition and its importance for Aboriginal people, it is intended to be given prominence to decision makers under the Children, Youth and Families Act 2005 by placing it up front in the new part of the Act. And the bill recognised the critical role connection to culture and family plays in the development of Aboriginal children, and in protecting them from harm is recognised, understood and considered from the outset of engagement with the child protection system. This bill is an acknowledgement that Aboriginal children achieve better outcomes and the overrepresentation of Aboriginal children in care is reduced when Aboriginal people and organisations are involved in making those decisions for Aboriginal children. So across many Commonwealth countries, there has been a trend to acknowledging the harm successive governments have had on local Indigenous communities. And many other jurisdictions have been working towards addressing these wrongs for many years. And it was pleasing that with the change of federal government, that one of the first things that Prime Minister Albanese addressed in his speech on election night was the need for the federal government to listen and take action in righting the wrongs of the past. The federal government is already making changes, with New Zealand Prime Minister Ardern being the first foreign leader to visit the new Prime Minister. There was an acknowledgement that governments could share notes on addressing injustices for Indigenous communities. And this is important whilst knowing that each community is unique, not just internationally, but also often within clans and local communities. We can't have a one-size-fits-all approach. This is where self-determination is vital and is working towards successful outcomes. As I mentioned earlier, it's a shame that it has taken so long to get to this point, but with this Andrews Labor government and now a more progressive federal Albanese government, now is this time to take the real action. The journey together has begun. I commit as the member for Melton and the Parliamentary Secretary for Health to walk on that journey with Aboriginal communities and to support them and assist them as much as we possibly can. I support this legislation, I commend this bill to the House, and I thank the Minister for bringing this legislation to the House. Thank you.